gentlemen, namaste and good morning. It is so difficult when there's so much to say and so much that you feel, and yet it is so inspiring to see all of you. I've been given this topic of imagine, and I heard that it was said in Sanskrit that what is seen by the inner eye, if it's felt in the heart, can soon be seen by the outer eye of not just the individual, but of everyone. And I think it was our chairman who taught us how to dream in the day and to make those dreams and visions and imaginations a reality. So today I'm going to very, very quickly, because I know there's so many wonderful speakers after us and the main event is really coming next, I'm going to very quickly share with you a few thoughts and a few visions of how all of us can imagine together so that the world can see something special. So let's imagine a perfect world. Let's imagine how we can move to a different level of universal health access. How can we make every single person have geographic and financial access to the best of care? Do we use technology, connected systems? Can we take healthcare into the cloud and then take healthcare into the community? Can we find ways to use every single skill set of every single sector to create this concept of universal health access, whether they're in a remote area, whether you need to take a drone to fly that life-saving medicine, whether you will empower the healthcare worker because you will give him that knowledge right there, or you will give him the equipment and the capability to do something. Let's imagine universal healthcare in a way that only we can dream first in our mind and then make a reality. Once we've got our universal healthcare of financial and geographic access, let's say that this may be a little tough to do. So how do we change the game of healthcare? By focusing on the social determinants of health. So we imagine that everyone has access to clean drinking water, to sanitation, to hygiene, that we're not filling our hospitals with dengue and chikungunya, but we're finding ways to clean, make the environment better, give ourselves better nutrition, use epigenetics and some of the latest and yet some of the oldest knowledge to bring back. And before we speak, we must do, because we want to be the change. This is Aragonda, our village where our chairman was born, where we are not just taking care of the healthcare of 60,000 people from birth through life, through screening, through diagnosis, through nutrition, through sanitation. Let's focus on primary healthcare for everyone so that the burden of disease itself reduces. Let's imagine that world where we need to do less curing because we've cared enough to create primary healthcare. Moving on, I think one of the most important aspects of health is really the environment we live in. And in this environment of traffic, of pollution, of stress, of garbage, of plastic, 1/7 of our oceans will be full of plastic. Can we recycle? Can we enable our footprint to be softer? And each one of you will see in your kids that we're not just gifting you the pleasure of just all being together, but also gifting you a tree that we may plant and we may keep in our environment. So let's imagine a cleaner, greener, safer, environmentally sound world that we all live in together that creates a less stress. And these are models which are happening across the world. They're doing it in small pockets. Let's imagine it for the world, that we will have this new environment. Moving on, I know that Mark spoke extensively about something which is the most important in healthcare and something that I have for the last 29 years in healthcare felt, and that is the people. It is our workforce that makes healthcare what it is. It is this healthcare which heals patients, which cures patients, which alleviates pain, and then imagines how we can do more. So let's imagine this new workforce where there are enough doctors, there are enough nurses, there is enough technology enabling them, because the future of healthcare is not just about this, but it's about teams. It's about working together in a connected world, and it's about learning the new skills and the new techniques which are required So whether we're using immersive learning, or whether we're using robots, or whether we're finding ways to learn from our phone or to learn from imaging, which happens all the time. But in this new environment, where the mobile and the sim and the support that can happen in sim labs, I visualize that we will have enough people, that the 18 million workforce shortage, which could go up further, can actually come down. Number one, because India may become, the young India may help to heal the aging world. Number two, because the entire nurses, paramedics will move up in their skills and move up in their roles. And in this enhanced roles, will doctors become free and idle? No, they will not, because science is moving and changing, and doctors will move one level further to go beyond clinical care to research and to education, because the margin for error today is zero. We must train more. We must practice in simulated environments more so that we find this new healthcare. So I visualize and dream and imagine together with all of you a new workforce of the future, which is empowered with knowledge, which works in teams, which is adequate, and most importantly, a workforce which is respected. Finally, and most importantly, I think we must imagine that everything we do in healthcare is about bringing health and happiness. It's about bringing smiles on people's faces. It's about children having the faith and the hope that we can all be together and they will see their parents and their grandparents grow old. But I also think it's for all of you to know in this room that maybe you, but definitely your children, are going to live to be past 100 years old. So let's imagine, let's innovate, let's inspire each other. Let's find ways to create this healthier, happier world. But most importantly, we're here together, and I'm humbled by the presence of all of you. Let's co-create this healthier, happier world. Thank you all so much for your friendship and partnership. Namaste.